If you're looking for an in-depth understanding of fluoxetine, you've come to the right place. In this video, we'll explore the common applications, benefits, potential adverse reactions, dosage guidelines, and dangers associated with this medication. Whether you're a healthcare professional or a curious individual seeking knowledge, we've got you covered. Common applications of fluoxetine. Fluoxetine, commonly known by its brand name Prozac, is an antidepressant medication that belongs to the class of selective serotonin reuptake inhibitors, SSRIs. It is primarily prescribed to treat major depressive disorder, panic disorder, obsessive-compulsive disorder, and bulimia nervosa. Additionally, it can be used to manage premenstrual dysphoric disorder and post-traumatic stress disorder. When it comes to major depressive disorder, fluoxetine is widely used as a first-line treatment. It helps alleviate symptoms such as persistent sadness, loss of interest, and changes in sleep and appetite. For panic disorder, fluoxetine can reduce the frequency and severity of panic attacks, allowing individuals to regain control over their lives. Obsessive-compulsive disorder, OCD, is another condition that fluoxetine is commonly prescribed for. By increasing serotonin levels in the brain, it helps reduce intrusive thoughts and compulsive behaviors, enabling individuals to lead more fulfilling lives. Fluoxetine has also shown effectiveness in managing bulimia nervosa, a serious eating disorder characterized by binge eating followed by purging behaviors. In addition to these primary applications, fluoxetine can also be used to treat premenstrual dysphoric disorder, PMDD, and post-traumatic stress disorder, PTSD. PMDD is a severe form of premenstrual syndrome, PMS, that causes emotional and physical symptoms, and fluoxetine can help alleviate these symptoms. For individuals with PTSD, fluoxetine can reduce anxiety, nightmares, and intrusive thoughts associated with traumatic experiences. Fluoxetine's versatility in treating various mental health conditions makes it a popular choice among healthcare professionals. However, it's essential to consider the potential benefits and risks before starting this medication. Benefits of using fluoxetine. Fluoxetine offers several benefits for individuals struggling with mental health conditions. By increasing serotonin levels in the brain, it helps regulate mood and emotions, leading to an improvement in depressive symptoms. It can also reduce anxiety and panic attacks, providing relief for individuals with panic disorder. When it comes to OCD, fluoxetine can significantly reduce the frequency and intensity of obsessive thoughts and compulsive behaviors. This allows individuals to regain control over their lives and engage in activities that were previously hindered by their condition. Additionally, fluoxetine can help individuals with bulimia nervosa by reducing binge eating episodes and promoting a healthier relationship with food. For individuals suffering from PMDD, fluoxetine can alleviate symptoms such as irritability, mood swings, and physical discomfort. By balancing hormone levels and improving serotonin function, it helps individuals navigate through the challenging premenstrual phase with more ease. Similarly, for individuals with PTSD, fluoxetine can reduce anxiety and intrusive thoughts, allowing for better coping mechanisms and improved overall well-being. It's important to note that the benefits of fluoxetine may vary from person to person. It may take several weeks for the medication to reach its full effect, and dosage adjustments may be necessary to achieve optimal results. Consulting with a healthcare professional is crucial to ensure the right dosage and treatment plan are established. Potential adverse reactions of fluoxetine. While fluoxetine can significantly improve mood and alleviate symptoms associated with mental health conditions, it's important to be aware of potential adverse reactions. These adverse reactions can vary from person to person and may include nausea, insomnia, sexual dysfunction, and gastrointestinal issues. Nausea is one of the most common side effects reported with fluoxetine use. It usually occurs during the initial weeks of treatment and tends to subside over time. Insomnia, on the other hand, can be experienced as difficulty falling asleep or maintaining sleep. This can be managed by taking fluoxetine in the morning or adjusting the dosage under the guidance of a healthcare professional. Sexual dysfunction, including decreased libido and difficulty achieving orgasm, is another potential side effect of fluoxetine. While it may impact some individuals, it's important to note that not everyone experiences this side effect. Open communication with a healthcare professional can help address concerns and explore potential solutions. Gastrointestinal issues, such as diarrhea or constipation, may also occur during fluoxetine treatment. These side effects are usually mild and transient, but if they persist or worsen, it's important to consult with a healthcare professional for further evaluation. In rare cases, fluoxetine may cause more severe adverse reactions, including serotonin syndrome and suicidal thoughts. Serotonin syndrome is a potentially life-threatening condition characterized by symptoms such as agitation, hallucinations, rapid heartbeat, and increased body temperature. Suicidal thoughts or worsening depression can also occur, especially in young adults under 25 years of age. Monitoring for any changes in mood or behavior is crucial, and immediate medical attention should be sought if any concerning symptoms arise. Understanding the potential adverse reactions of fluoxetine can help individuals make informed decisions and seek appropriate medical care if needed. It's important to weigh the benefits against the risks and discuss any concerns with a healthcare professional. Dosage guidelines for fluoxetine. Dosage guidelines for fluoxetine can vary depending on the condition being treated and individual patient factors. It's essential to follow the prescribed dosage and consult with a healthcare professional for guidance. For major depressive disorder, the usual starting dose of fluoxetine is 20 mg per day, taken in the morning. Depending on the individual's response, the dosage may be adjusted after several weeks to achieve the desired effect. The maximum recommended daily dose is 80 mg, but higher doses may be necessary in some cases under close medical supervision. For panic disorder, the initial recommended dose is 10 mg per day, with an increase to 20 mg per day after 1 week. The maximum recommended daily dose is 60 mg. It's important to note that panic disorder treatment may require a longer duration of treatment compared to other conditions. When it comes to OCD, the starting dose is usually 20 mg per day, with the possibility of increasing to 60 mg per day if needed. Dosage adjustments should be made cautiously and under the guidance of a healthcare professional. For bulimia nervosa, the usual recommended dose is 60 mg per day. However, it's important to note that fluoxetine has not been approved for long-term use in this condition. Dosage guidelines for PMDD and PTSD may vary, and it's essential to consult with a healthcare professional for individualized recommendations. It's important to take fluoxetine as directed and not to abruptly stop taking the medication without medical guidance. Abrupt discontinuation can lead to withdrawal symptoms and worsen the underlying condition. If there is a need to discontinue fluoxetine, a healthcare professional will provide appropriate guidance to gradually taper the dosage. Understanding the recommended dosage guidelines for fluoxetine is crucial for achieving optimal treatment outcomes. Regular follow-up appointments with a healthcare professional are essential for monitoring progress and making any necessary adjustments. Understanding the dangers of fluoxetine. Before starting fluoxetine, it's crucial to understand the potential dangers associated with this medication. Misuse or abrupt discontinuation can have adverse effects on mental health, leading to withdrawal symptoms or even worsening depression in some cases. One of the dangers of fluoxetine is the risk of serotonin syndrome when combined with other medications that increase serotonin levels. Serotonin syndrome is a potentially life-threatening condition that requires immediate medical attention. It is characterized by symptoms such as agitation, hallucinations, rapid heartbeat, and increased body temperature. It's important to inform healthcare professionals about all medications being taken to minimize the risk of this condition. Another danger associated with fluoxetine is the potential for suicidal thoughts, especially in young adults under 25 years of age. Close monitoring for any changes in mood or behavior is crucial, and immediate medical attention should be sought if any concerning symptoms arise. It's important to have a support system in place and to communicate openly with healthcare professionals about any concerns. Abrupt discontinuation of fluoxetine can lead to withdrawal symptoms, including dizziness, irritability, nausea, and flu-like symptoms. It's important to work closely with a healthcare professional to gradually taper the dosage when discontinuing fluoxetine to minimize the risk of withdrawal symptoms. Understanding the potential dangers of fluoxetine can help individuals make informed decisions and seek appropriate medical care. It's important to communicate openly with healthcare professionals and report any concerning symptoms or changes in mood or behavior. Precautions and contraindications for using fluoxetine. While fluoxetine can be an effective medication for many individuals, there are certain precautions and contraindications to consider. Fluoxetine should not be taken by individuals who are allergic to the medication or have a history of allergic reactions to other SSRIs. It's important to inform healthcare professionals about any allergies or sensitivities before starting fluoxetine. Individuals with a history of bipolar disorder or mania may experience an exacerbation of symptoms when taking fluoxetine. Close monitoring is necessary in these cases to ensure appropriate treatment and management. Fluoxetine can interact with other medications, including monoamine oxidase inhibitors, MAOIs, linezolid, and certain medications used to treat migraine headaches. These interactions can lead to serotonin syndrome, a potentially life-threatening condition. Informing healthcare professionals about all medications, including over-the-counter medications and supplements, is crucial to minimize the risk of interactions. Individuals with liver or kidney impairment may require dosage adjustments or closer monitoring when taking fluoxetine. It's important to discuss any pre-existing medical conditions with a healthcare professional to ensure safe and effective use of the medication. Fluoxetine should be used with caution during pregnancy, as it may pose risks to the developing fetus. Healthcare professionals will carefully weigh the potential benefits against the risks and provide individualized recommendations. It's important to discuss any pre-existing medical conditions, medications, or concerns with a healthcare professional before starting fluoxetine. Open communication and collaboration are key to ensuring safe and effective treatment. Alternatives to fluoxetine. While fluoxetine can be an effective medication for many individuals, it may not be suitable for everyone. In some cases, alternative medications may be explored. Other SSRIs, such as sertraline, Zoloft, or escitalopram, Lexapro, are commonly used alternatives to fluoxetine. These medications work similarly by increasing serotonin levels in the brain and can be effective in treating various mental health conditions. For individuals who do not respond to or cannot tolerate SSRIs, other classes of antidepressant medications, such as serotonin norepinephrine reuptake inhibitors, SNRIs, or tricyclic antidepressants, TCAs, may be considered. These medications work through different mechanisms and can provide relief for individuals who do not respond to SSRIs. In certain cases, non-medication approaches, such as therapy or lifestyle modifications, may be explored as alternatives or adjuncts to medication. Cognitive behavioral therapy, CBT, and other forms of psychotherapy can be effective in managing mental health conditions and improving overall well-being. It's important to consult with a healthcare professional to explore alternative treatment options if fluoxetine is not suitable or effective. A personalized approach will ensure the best possible outcomes for individuals seeking treatment for their mental health conditions. Frequently asked questions about fluoxetine. How long does it take for fluoxetine to start working? Fluoxetine may take several weeks to reach its full effect. It's important to be patient and continue taking the medication as prescribed. If there are concerns about the medication's effectiveness, it's important to discuss them with a healthcare professional. Can fluoxetine be taken with other medications? Fluoxetine can interact with other medications, so it's important to inform healthcare professionals about all medications being taken. This includes over-the-counter medications, supplements, and herbal remedies. Interactions with certain medications can lead to serotonin syndrome, a potentially life-threatening condition. Can fluoxetine be used during pregnancy? The use of fluoxetine during pregnancy should be carefully evaluated, weighing the potential benefits against the risks. Healthcare professionals will consider individual circumstances and provide recommendations based on the latest research and guidelines. Can fluoxetine be addictive? Fluoxetine is not considered addictive. However, abrupt discontinuation can lead to withdrawal symptoms. It's important to work closely with a healthcare professional to gradually taper the dosage when discontinuing fluoxetine. Can fluoxetine be used in children and adolescents? Fluoxetine is approved for use in children and adolescents for certain conditions, such as major depressive disorder and OCD. However, healthcare professionals will carefully evaluate individual cases and provide appropriate recommendations based on the latest research and guidelines. It's important to consult with a healthcare professional for personalized answers to specific questions and concerns about fluoxetine. Conclusion: is fluoxetine right for you? Fluoxetine, commonly known as Prozac, is an antidepressant medication that belongs to the class of selective serotonin reuptake inhibitors, SSRIs. It is commonly used to treat major depressive disorder, panic disorder, OCD, bulimia nervosa, PMDD, and PTSD. By increasing serotonin levels in the brain, fluoxetine helps regulate mood and alleviate symptoms associated with these conditions. While fluoxetine offers several benefits, it's important to be aware of potential adverse reactions and the dangers associated with the medication. Nausea, insomnia, sexual dysfunction, and gastrointestinal issues are some of the potential side effects that may occur. Close monitoring is necessary to identify any changes in mood or behavior, as fluoxetine may increase the risk of suicidal thoughts, especially in young adults. Dosage guidelines for fluoxetine vary depending on the condition being treated, and it's important to follow the prescribed dosage and consult with a healthcare professional for guidance. Abrupt discontinuation should be avoided, as it can lead to withdrawal symptoms and worsen the underlying condition. Fluoxetine may not be suitable for everyone, and alternative medications or non-medication approaches may be explored. It's important to discuss individual circumstances, concerns, and preferences with a healthcare professional to determine the best treatment plan. In conclusion, fluoxetine can be an effective medication for individuals struggling with various mental health conditions. By understanding its common applications, benefits, potential adverse reactions, dosage guidelines, and dangers, individuals can make informed decisions and seek appropriate medical care.